We muted, like, I think I have it up. Do I have it right this time?
This is, yep, go back to Zoom.
This one?
No.
That's it? Okay. The video's off. Is the audio good?
The HH committee meeting, and I'd like us to stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Begin with roll call. Legislator Elaine Daly is present. Legislator Brian Muldrow is present. Legislator Bob Shea is present. And Legislator Tom Winslow is present. We have minutes to approve from January 8th. Do I have a motion?
I'll move them.
I'll second.
Any questions or discussion? Hearing none, all in favor? Any opposed? Those minutes carry. We have one appointment, which will be on our full legislative meeting later in the month for the OFS Advisory Committee. So that's just something to note. And we'll begin with department updates. I'm going to flip things around a little bit and ask Brenda Wyman to come up because she has no resolutions. You can join us right at the table.
Thanks. Sit next to Brandon.
Hey, that's one for you. Joy.
Hi. Really crazy day, so I feel a little unprepared, but and without a resolution. But there's a couple of things I will update you on that are going on in our department. We are 17% federally funded, and so far we're not hearing any significant impacts, except that, you know, I've talked about our health insurance counseling program and how busy we were this past year and how many more people we had asking for help and how much more complicated their scenarios were. We were notified that the state health insurance program, which is the overreach for our local program, but at the federal level, is no longer available to us for training and assistance. So they were one of our resources to make sure our staff were trained and had the resources they need. And then the other thing that we were told is that Center for Medicare and Medicaid Services also are no longer available to us to problem solve. So we used to have a way of liaisoning to them through the New York State Office for the Aging, and that's on hold. So that's just a little bit of an update on, normally we don't use those resources constantly, but they're what helps our health insurance counseling staff have the expertise and be able to problem solve those difficult cases. So that's a little bit concerning, but we'll see what happens with that. The other thing I wanted to mention is, you know, under normal circumstances, we do have excellent support and training for our Medicare insurance counselors. And that's why we're able to do so much for people with Medicare. A lot of folks assume because we work with people 60 and over and we're all the Office for the Aging, we have answers to everything that might apply to somebody who's older. But the reality is we have zero ability to help people with Social Security. You know, there was a Social Security office here in Auburn at one time. Prior to COVID, I know the office closed at least 10 years ago. And prior to COVID, they were still sending representatives out here to meet with people at the Boyle Center. During COVID, that completely ended. We don't receive any training, no different than any of us in this room, in terms of knowledge or ability to counsel people on Social Security. In the past, we could kind of help people call Social Security. More and more, they want everybody to go through the internet for their Social Security assistance. And they, any of you who've looked into your own account with Social Security, they've upped the authentication and what you need to do to have an account. Which means that people that don't have internet, don't have email, aren't able to go through that process on their own. We also can't help them because we can't set everybody up with an OFA email through Social Security. They won't let us use the same email and same phone number for everybody. It defeats the purpose. So I just wanted to share that you know, as more and more people are needing Social Security and being able to get a hold of them, it's just getting harder and harder for us to help folks even access Social Security. Wait times on Social Security calls can be anywhere from 30 minutes to 2 hours. So we can't even sit there on our office phone with somebody for that long a time. And a lot of these individuals have very low incomes, that may need to do some reporting and get some assistance. And their own phones, they may have limited minutes phones, so they can't sit on the phone, so it's waiting for Social Security. So that leaves them, if they don't have transportation, taking the bus to Syracuse and hoping that they'll get seen when they show up. So I just bring that up because it's part of our No Wrong Door, New York Connects group that works together and identifies issues and problems and how to kind of figure out what we can do to kind of help solve that. And initially, we are wanting to let all of you know about it so that it's on your radar, that this is a problem for the constituents and folks in Cayuga County. We'll be writing to our elected officials, to our federal officials especially, to let them know about it. And when we have opportunities, share that information in person as well. It's a little bit reminiscent of when COVID hit and all the older folks were told to go online to register to get their COVID shots. And, they called us to help with that, and yet we had any ability to help them really any more than anybody else in the community did. And, it's hard and frustrating because we certainly want to be able to help folks, but that's just one of the realities that it's a challenge for the older folks and folks with disabilities that are on Social Security. So just wanted you to be aware.
Thank you. Thank you for putting some of those things on our radar.
Any questions?
I just have a question. The training for your staff on Medicare counseling is what's at risk. But the backup of if you're too full to counsel, referring people you had reported at your last meeting that when you are overloaded with people wanting to get some information about what right Medicare product is good for them, the state has the ability to help people. That's not what's at risk. It's the actual training of your staff that's at risk.
Currently, the state Medicare assistance programs that are able to help us during annual enrollment specifically are still available.
Okay.
It's the higher level technical assistance problem solving that we're losing right now.
And the people that come for Social Security issues are not really wanting to know how to qualify for SSI disability, but just Social Security questions in general.
It could be Social Security disability. It could be loss of a spouse due to death. It could be change of address, which sometimes, depending on the type of Social Security assistance you're getting, has to be reported in person. It could be getting a duplicate card. It could be getting verification of income.
Anything.
Yeah.
Anything. Okay.
Yeah.
I know DSS does some kind of program for people looking for disability, but that would be people that are on public assistance.
Correct.
Right.
Correct. So, yeah.
Okay.
Otherwise, things are good. I try to be.
Turn it on a positive
I try. Any other questions or anything? All right. Thank you.
note.
Deborah Dennis also has no resolution, so I'll have you come up and update.
Sorry, you have to go to 2 committees, Deborah Dennis. She was there last night.
So, I don't have any resolutions this evening. I just want to kind of give you a status of where things are with the Youth Bureau. Just kind of wrapping up the reimbursement for 2024 funding. That's all due to the state by March 31st, and there's no flexibility with that deadline. So I did run into an issue with a current contract that we're working with law to terminate because they did not claim their funding after several attempts of getting in touch with this organization. So next month, hopefully I'll be looking for a resolution to reallocate the 2024 funding to another youth team sports group. It has to be a group that we've already allotted funding to. So that resolution may be coming to reallocate that $4,500 that was not claimed by a different organization. For 2025, I'm just kind of working right now on getting the contracts ready to get sent to law to get those contracts in place for the 2025 organizations, and then working with some of our new people who don't know how the reimbursement works. They have to spend first, and then we reimburse them and showing them how to fill out the forms. And then we do a claim to the state. So just kind of getting them familiar with that. lot of their programs haven't started yet. I think the majority of the programs we fund tend to be more spring, summer programs. We do have monthly meetings with the New York State Association of Youth Bureaus, and they did a kind of a recap of the governor's budget. So it is looking promising as far as hopefully with youth programs. I know that the governor has some of the things that she highlighted for the 2025 budget that she would like to put forth. Hopefully will benefit youth bureaus throughout the state. A couple of things that she touched on were after school programs and youth mental health, an initiative for unplug and play, as well as places for learning and activity and youth socialization. And she indicates ideally, hopefully increasing the state support for youth sports and programming. So hopefully that will in turn allow the Youth Bureau to get more funding from New York State. And usually I know that number middle of the summer. So that's hopefully good news for us. I hope it doesn't affect everything I know going on with the federal funding. We did receive a memo that the state is really hoping to be still supportive as much as they can for youth and children and families that definitely need the services. So hopefully that all goes well when the budget time hits for New York State, and then in turn benefits as well. So that's all I have this evening for an update. If anybody has any questions.
Okay, thank you.
You're welcome.
So I'm going to go in order of resolutions and have Kathleen Cuddy up next. She has two resolutions from the Health Department. Why don't we take a look at your resolution first, and then you can get into your update. So H1, authorizing the chair of the legislature and health director to enter into a contract with Board of Health approved hearing officers to conduct administrative hearings for the Cayuga County Board of Health. Can I get a motion to put this on the table?
Second.
Thank you.
Thank you. So we contract with two individuals to act as hearing officers, which is a requirement as public health law, and part of our process. It's been a couple of years. There had been a request to see if they could have an increase to $50 an hour from $48 an hour. And so I am bringing forward that resolution to request that. I have a little bit of background. We in 2024, spent less than $2,000 for both hearing officers. We track that. So assuming it's a similar number of hours this year, it would be a very minimal increase in dollar. It'd be less than $100 in total if they were to work the same amount.
Any questions with the resolution? Any discussion? Hearing none, all in favor?
Aye.
Any opposed? That passes. Thank you. And then HH2, authorizing the public health director to accept funds of $23,286 from New York State for participation in Article 6 State Aid Year 12 Performance Incentive Program activities completed by the Health Department.
So 12 years ago, the state allocated $1 million of its budget to be distributed amongst local health departments that took part in whatever that year's annual performance enhancement was. So this past year, it was looking at some chronic disease related work in parks and working with communities. Some years it's been looking at STIs, sexually transmitted infections and getting information out that way. Other years it's been water quality. So at any rate, we did participate and consequently were awarded $23,000 to put toward Article 6 type work.
Right. So in this resolution, we need to increase the expenditure
Yes.
from 23 to 23,186, and then increase revenue.
Right.
23,236. Any discussion about that resolution?
Flexible, you decide what you want to use it on?
We do, and we have some plans. So we know, for example, in our 2025 budget, we didn't have quite enough money to cover our annual fees for our computer systems like McGinnis and Medent. So this will round that off amount. It qualifies for it. We may look to do some work with this year. Our community health assessment has to be performed and an update to our community health improvement plan. So if we're looking to do some paid something to help us attain that information, then that gives us a little flexibility to do that.
Other questions, discussion? Hearing none, all in favor?
You had a-
You need a first and a second.
Oh, I'm sorry.
I'll move it.
It's on the table.
Second.
Thank you.
Thank you.
All in favor?
Aye.
Any opposed? Passes. Thank you. And updates.
Thank you. I have a few things to update with. If you don't mind, I'll pass these around for people to look at. And hard copies for you to keep. But before I go over that, just as part of our corporate compliance, we should be giving quarterly updates now. That's a new request. We're kind of putting together a format to do that, to give you similar information each quarter, but in lieu of having a lovely template put together, I'll give you a verbal update here. Corporate compliance, a lot of times we focus on, it encompasses a lot, but where we put a lot of our focus and effort is on appropriate Medicaid billing and making sure that what we bill for is acceptable. Okay. So areas where we bill, maybe immunizations. A number of we have very little straight Medicaid that we receive for immunizations because a lot of people either have private insurance or a managed care plan. But with our Medent system, there are some checks and balances built into that system because it has the ability to verify Medicaid eligibility and confirm receipt of the appropriate consents, which are very important in order for us to bill, as well as verifying our billing procedure codes for our electronic claim submission. The other two big areas where we have Medicaid billing that goes back and forth is the early intervention program. And that is billed through the EI hub that you've heard us speak about, and that's still rife with challenges. That is a New York State program. Providers enter their billing, so providers meaning like the OTs, the speech therapists, et cetera. They enter their billing into the web-based portal, and the state program then bills Medicaid and pays the provider for any claims that are Medicaid or non-Medicaid. They pay through the escrow account that our department, the county finance office, has to keep at a certain level. The providers are paid through the county escrow account mandated. 49% of the escrow account is received back for non-Medicaid services. It's in different formulas that have to be used. For service coordination, we also submit for payment. So there is some revenue. I think it's part of the request that Ways and Means is asking for. We'll talk a little bit about some of the revenues that come in ongoing. Preschool special education is the other big program where there is a significant amount of money that is related to Medicaid that gets processed. The computer system we use called McGinnis is incredibly helpful and has really helped us refine any concerns, that human error could have brought forth by automating this now. Because unless every document is in place and it's been verified by our staff, you cannot submit for Medicaid billing. So that's a really great check and balance as part of our compliance efforts. We also have our supervising staff who do quality assurance checks for our early intervention service coordinators. And of course, our fiscal manager who is very knowledgeable about our programs as well, who check this routinely, and we meet monthly or more often as need be to speak specifically about pre-K, and we meet weekly to talk about all of our regular financial related work. So we do try to stay on top of that, and you'll hear more about it, but that's my official corporate compliance report to you.
It's designated as the Compliance Officer,
Our Deputy Director, Deanna Ryan.
like Deanna's filling that role.
Just as a point of interest, I asked this question because there's been a lot of illness that's gone through the health department in the last few weeks, and it's not unique. I think it's going through everywhere. For flu, all of last year during the flu season in Cayuga County, we have a record of 47 people being hospitalized for flu. We're 18 weeks into the flu season. In Cayuga County, 52 people have been hospitalized due to flu. That is telling you that people have the flu and it's bad. So something to just be aware of, try to avoid it. It's not too late to get your flu shots. What I've passed out is our 2024 statistical report. I do this really to give you a sense, it really quantifies some of the work we do, probably about, I'm going to say it reflects about 80% of the work, 85% of the work that we do. And it identifies some of the programs in a little bit better detail. It doesn't, it's not a quality control thing. It really helps us identify how busy are we in certain areas? Are we not in other areas? Why the changes from year to year. And it's been helpful to have like a 5-year look back period, right? And you certainly can see when we look at some of these areas where our COVID response significantly influenced some of the other work we were doing, but work that needed to be done still continued during that time period. It's not real pretty. We don't have bar graphs and charts at this moment, but it is very helpful. And it's been very helpful to us also when we write grant applications and we use some of this data with our community health assessments and things like that. So I'm just going to hit a few highlights for you. On page 4, we're speaking to some of our immunization clinics. In 2024, we served a few lesser numbers in the previous year, but there were more vaccines that were provided, and we are the safety net provider. So these are not the optional shots for people. And I mentioned this at our Board of Health. I don't know that I've spoken much about it here at HHS, but many of our participants who come to us for vaccine are eligible for our Vaccine for Children program, which is a federally funded vaccine program. There's a lot of rules around being a Vaccine for Children provider. Yes, you have to economically qualify, but you have to keep a log of the temperature twice a day. You have to have different, it's very labor intensive. So we have found that a number of healthcare providers in the community are not providing vaccine for children, which is part of the reason we see an increase. Even offices that might carry, so some might carry private stock, but not vaccine for children. So they might not be able to serve all their patient load. But then some offices are just getting out of the vaccine business because it's costly.
And this includes pediatricians.
It includes pediatricians, family care providers, other primary care providers. So that's in part where we've seen an increase in the number of children that we serve in particular.
So that 775, that's including like infant babies to get vaccinated when they come in. You know, do we know how many births we have? Is this the county, right? Imagine.
This is in our county.
So how many births do we have of children?
Annually? I will look that up to verify that. I want to say for over 400, but I would be remiss if I didn't look it up. And we do have a manner to be able to check. It's called a perinatal network that we can see how many children were born to Cayuga County residents last year.
These are individuals who come to the county health department for their vaccines.
Correct.
Some people still go to their primary care,
Absolutely.
especially babies.
Yes,
Their primary care provider, and Vaccine for Children is Medicaid and uninsured.
correct.
So there are people that are doing vaccine. You don't have record of them.
Oh, yes,
So-
yes.
I
Yeah,
might
so somebody go to
go-
primary. That's what I was getting at.
Right.
Okay.
I
all
used
right.
to-
I just thought it was a.
So there were people who might
I
go
know
to
it sounds
children's
like a
health
dumb
specialists.
question,
No,
but
it's
I
not.
think about
It's
it, you know.
not. So like children's health specialists is one of the pediatric practices. they participate in Vaccine for Children and they have private. So their patients are seen at the doctor's office. So this is the fraction of our population who is not seen at their private doctor office
Okay.
to get their shots. We've got just highlighted a few of our communicable diseases. I think what's of interest on page 5, Lyme disease, slight increase, but I think that goes along with tick-borne diseases, right? And that's often very weather-related and cyclical as well. Tuberculosis remain, it's rare, but it happens and does happen in our community. Our WIC office, you'll see on page 7, the actual participants that we served, 1,419 from last year. Our early intervention, I had a question about this, so I think that's worth taking a look on page 8. In 2024, when we looked at the number of children in active program, I said to our coordinator, I'm like, wow, that's a drop from the previous year. And they went back and they verified the numbers to make sure they were accurate. And indeed it is. So that's, reflective of the children who are eligible. We did see a rise in children, we call them our COVID babies, who were born during the pandemic declarations. And we think that certainly has impacted people. But you'll see that the 100 less children in early intervention then translated into pre-K. So you'll see that there's 100 more children in the 3 to 5 program for this past year. So it's not
Identified early, that's
yeah.
a problem.
So they were exactly, that's exactly. And as most of you are aware, children who are eligible for early intervention can be referred by anybody. They can be a call from your parent. It can come from your daycare provider. It can come from grandma. It can come from the pediatrician's office. And children are assessed to see if they are eligible to receive services. They may or may not be. They may be encouraged to wait a few months as their developmental, they age up and they develop more skills. But they can be part of what we call the Child Find program. So we touch base with parents and say, hey, have you seen a change in your child? Is your child rolling over yet? Well, why don't we come out and assess them again and we'll see how things are coming. So it's a very busy program. And so again, the preschool where I'm looking at that on page 9 is just as busy, if not busier, right? And you'll see early intervention, we're tracking our wait list. Some of our early intervention children are in need of more than one service. And when we look at our preschool on page 9, we'll see not only 359 children that we had in our last year's school program. We've got 30 children who are in Cayuga County tuition-based program. We've got 10 children who are attending preschool outside of the program in a tuition-based program, and 57 children who are on a wait list. Those children who are in the tuition-based preschool programs, they are children who are going to that special preschool class. Other children may be going to Head Start or YMCA or some other preschool program and receiving services within their typical preschool class. They might have the speech therapist coming in, or someone might be having the physical therapist come to daycare, or your OT is coming home if you've got a parent or grandparent who's at home with you. So children receive services in different ways, but it is a challenge. The providers, as we've talked about, there's a great need for providers, particularly in rural areas. There's supposed to be an increase to pay providers for early intervention within the state budget, but that has not translated yet into actual money in the pocket of those providers. So hopefully we'll hear more about that in the not too distant future.
Can I ask a question? The 10 children getting tuition-based program outside of the county, those are quite expensive.
Correct.
That's the transportation, that's a huge cost.
So Yes. So transportation may be for some of the in-county children also.
Okay.
Although we always encourage all parents to see if they're able to transport their children themselves because it is less costly. But you're absolutely correct. For the majority of our out-of-county children, and I can get specifics,
But
it is a busing cost on top of the tuition cost. And tuition is expensive. It is as much as college tuition and some state college level tuition. It really is nearly as much as that.
Everest is now full day, and so are most of the programs.
Yes, there are very, very few part-day preschool programs anymore. Right? It would serve more children if there were
Yep.
part-day, but that is not the case. So where else are we looking at? Our lead poisoning program, highlight a few things, but one of the really good news in there is toward the bottom of page 11. We had 18 children who were discharged from the program. That is twice as many as the previous year. And a lot of credit goes to our lead program coordinator, who is very engaged with the families. It goes to the healthcare providers who are staying engaged with families and having children tested routinely, because you have to test, you have to have 2 blood tests under the 5 micrograms per deciliter in order to be discharged from the program. And it's a lot of work. If you live in an older home, you might have identified one of the sources of exposure to where your child might be getting lead. Let's say that's just dust from doorways and windowsills and things like that. It's a lot of effort to maintain that cleaning, to get your child in the habit of washing their hands before they eat, to try and discourage, putting your hands in your mouth. And that's where the majority, the majority of children who get exposed, that tends to be how that happens. Although there certainly are other manners in which children are exposed to lead dust and lead that can elevate their blood lead levels. So we're really pleased. I think that was really good news to be able to share in that regard. We do still have our cancer screening program. That's a 3-county program that people who, again, are uninsured or underinsured. So for example, if your health insurance does not cover a mammogram, for example, or a colonoscopy, you may be eligible for participation in this program. It's breast cancer, cervical cancer, colon cancer screening. And this, we work with Cortland County and Tompkins County and Cayuga County. The 3 of us work together. The administrator is out of Cortland County and spends a day a week here in Cayuga County, but at any point in time can receive referrals for people to participate. And as you can see, it's really a beneficial program, because there have been people who've been screened, people who've been identified with cancer, and that's, the sooner it's identified, the sooner it can be treated.
And that coordinator from Portland County has been in touch with me. She would like to do a presentation. I'm going to see if she's available for our March HHS meeting. Essentially, what she's interested is getting the word out, finding ways to get other agencies who are involved in health provision to understand that this is available, and make referrals and take advantage of the free testing.
Our bike, pedestrian, wheel sport safety. We just, there's just an increased number of schools who are participating in some of the programs, and therefore the number of students has increased. But we've seen a big increase in a lot of our community events too, which is really great. We go to state parks and play space, and a lot of the SROs are very engaged. So that's a lot of good injury prevention there. Our public health fellow program, we're really pleased. Our fellows really serve to support our operations, particularly where we've had vacancies. And like our Healthy Neighborhoods program, they're very actively involved in that. They've helped us write grants. They'll be helping us with our community health assessments. So that's really marvelous. Public information, our number of formal press releases has gone down, which is good. Part of that was we were doing more in social media. We're toying with the idea of going back to doing more regular press releases, but a lot of this that you'll see here is like, it's your boil water orders. It's some sort of like a communicable disease outbreak. So it's a reminder about things going on that way. What's that?
It's down about 200%.
Right, so,
100%.
but, and so we were having conversation about that. When we send out our formal written press releases, it goes to the television stations, it goes to the radio stations. So I think by the thought that, oh, our social media is picking up a lot of that. Well, it's not picking up everything. So I think you'll be seeing next year an increase in that because you never know if there's a human interest story that's going to get covered. And a lot of times that does happen and it allows for greater exposure to the subject matter, which we like. So we would say, but in what is not identified here, and well, it's kind of tricky to find the best way to quantify this, but we'll find some ways to measure this, is our number of social media posts on our Instagram and Facebook are constant every day, constant and numerous throughout the day. Our YouTube videos we have created many, many more YouTube videos because, as Deanna has mentioned at many of our Board of Health meetings and other community meetings, literacy levels are all over the place, all over the board with people. And so to be able to see a video is very helpful, even more helpful than, say, a graphic. And then we're into our environmental health information. You'll see a lot of our water systems. There was an increase, one more non-community system, which is like a restaurant, campground, transient people in and out kind of thing. Big increases over the last couple of years in our mobile vending and temporary food service. And a big part of that is our mobile food trucks. It's still very time intensive to get them appropriately permitted, but it's really a great business model that's been very successful in serving a lot of people in our county. Septic system plans that have been approved. We had 79 approved last year, which is up from the previous year. Number of septic systems inspected. As you all know, we have the 7-year cycle for septic system inspection in Cayuga County. So you can see there was an increased number of those last year. ATUPA, the Adolescent Tobacco Use Prevention, that is where we are requested by the state to do regulatory work around the sale of nicotine products to underage people. And that was one of the reasons why we did an update policy wise with our tobacco law to help us with the enforcement of that, because the vaping that goes along with their classic cigarettes, it's been a real attraction, particularly for a younger population. And the state is a little slow to react to enforcement as per the state law. So our local law is helpful. Nuisance complaints, I think it's just always interesting to know there's always the oddball, I'm concerned about bed bugs, or my neighbor has trash in their yard, or, I think this restaurant had something that I didn't like. So we always follow up on all of those. Residential lead inspections, which, kind of goes hand in hand with our children and the blood lead level tests. Rabies prevention, you'll see a lot of exposures that we addressed this past year, and the number of pets that were vaccinated were increased. We receive rabies funding from the state as part of that rabies funding, which is used to offset some of the costs for this required service. We are also required to host 3 at no charge to the members of the public vaccination clinics throughout the year. And the SPCA has traditionally helped us in facilitating those. And so it was through these county-sponsored clinics that there were 359 pets that were vaccinated. A lot of information in here. You'll probably have some questions if you have a particular interest in a program. And at any point, please, give me a call or send me an email, and I'm happy to elaborate more. Okay. We'll be sharing this with the other legislators who are not here tonight, and with our Board of Health as well, and our own staff. Anything else? Right.
So even in 2023, we're seeing deaths in this county from COVID-19.
Yes, so we used to have to track that ourselves during the pandemic. Not have access to death certificate data in our county. It's only those local health departments that supervise the coroner's office that have access to death certificates at this point in time. So there's not an accurate count of deaths related to that. So we won't be monitoring that moving forward.
Do you want the extras, Kathleen?
Sure. Thank you. I'll come on to that.
Any questions, discussion for Kathleen?
Thank you.
Thank you.
Wonderful to have. Yeah, folks, social services. There is 3 resolutions. So we can take care of those first. H3 is authorizing the chair of the legislature and the commissioner of social services to enter into a contract with ABC Cayuga Inc. for services at Play Space. And I'll ask for a motion.
I'll move that.
So this agreement that we have, or contract with ABC Cayuga allows us to have folks that are TANF eligible be able to have a scholarship basically to go and utilize facilities there. We also have foster children that are in foster care that visit with their parents or resource there. Been very helpful for us to have that available to us, especially during the time that we've been out of the building for this last months. So we typically, we don't have a cap on the contract amount, but we're not gonna go over $10,000. It is not listed in here. We spent about 5,000 and 6,000 over the last couple of years. Probably between 50 and 75 individuals have been able to receive the assistance through this program.
You would impose your own cap, even though it doesn't say in an amount not to exceed 10,000.
Yep.
Do you have any data or even anecdotal data about those families who receive this scholarship and their use of Play Space?
How often they use it? Or just how it's helpful?
Not
to
how
them?
often, but actually taking advantage.
I think one of the best things about Play Space is that there's developmentally appropriate toys. There's staff that are trained in child development and have knowledge of services in the community. I think that they have made some referrals to help families get assistance when they've identified that they could use a little bit more of some of the supports that are in the community through mental health or through the Department of Social Services. So I think it's a way to have a community resource, kind of eyes on to help connect families to services that might, meet their needs. Again, I can't say enough about how it's been helpful for foster children to have a really nice place to go and visit with their families when they are having that, parenting time with their parents. The stuff that they have there that's developmentally appropriate for the little kids is something that we didn't have in the building. And it's not easy to find out in the community, even if you go to a park or, to the mall or something like that. So it's been a great resource for us.
Oh, yes, legislator Patel.
And this may be used for like supervised visits for the parents that have to have supervised visits.
Yep. So some of the visits that happen there are supervised. We have a caseworker, they can go down and can observe kind of quietly off to the side, or if they need to, they can even be like heavily involved in helping. They do allow us to do that. Sometimes the visits are supervised by even the foster parent if it's at that level of support that's needed. So so it's kind of a mix of the family dynamic and what the department's, level of supervision needs to be.
Anecdotally, I'll say that one time I was at Play Space with my great niece, and I ran into a caseworker from public health, and she was using Play Space as a community-based way to intervene with a child and family through early intervention. So it, It's helping the community in so many ways and helping our workers, our caseworkers to have a really remarkable spot to do, community-based connections with family and children. Any questions, discussion?
I don't think we voted formally. did we? You got a motion?
A motion.
Second, we
Yeah, we
didn't.
did.
vote. You did? Okay.
Any other questions or discussion? Hearing none, all in favor?
Madam Chair, due to having a relative employed at the play space, I'll be abstaining from voting on this, resolution.
Okay, thank you. Legislator Rinzler. So all in favor? Any opposed? And one abstained. So this passes. HH4 is amending the social services 2025 budget to accept funds from the administration for community living in the form of a grant to enhance adult protective services to respond to COVID-19. And the grant is $23,918.
Yes.
May I have a motion to put it on the table?
I'll move.
Second, I do have a question though. Is this, didn't know about this or the terms of this is not in here or?
So this is another allocation of money that we received. So this is the second or third allocation of ACL money that we've received that we just found out about recently that we're getting an additional $23,000. This particular allocation has to be spent by June 2025. So we can start as soon as we get approval through the resolution. We're gonna have to spend this $23,000 in the next.
This money expires June of 25.
Yep.
It doesn't say that though, but
No, we can, if you think that we need to put something in here. But we've received a few different amounts of money, all, but pretty much like similar to this, that they say is to enhance the adult protective services response to COVID-19. It really came about with families being very isolated, losing housing due to, the pandemic and the housing issue. We have found this money to be incredibly helpful in helping support particular individuals with different specific needs that they have. We've been able to do a lot of creative things with, trying to help people stay in their homes. Some of it's getting repairs to homes that people needed to help them be able to stay safely in their home. We've been able to purchase certain needed, necessities.
get it.
Yeah, it's very, very good.
You think this money's going away?
I don't know. I mean, we're gonna keep taking it as long as,
They came out of nowhere and now it's
Right.
yeah.
spent by June.
Yeah. And our county's been really good about utilizing it, and we actually asked for additional money because other counties had an allocation and didn't receive it. And so this was what we received as a request. They said anybody, who's used their money, want more money, and I asked for 40. They gave us 23. So I went high, but we'll take the 23.
Good.
Well, I'd like to make an amendment for clarity in the second whereas at the very end. And it is the intent of the department to engage in agreements when appropriate to provide these services. Scratch the semicolon and the word and to provide these services through June 2025. Comma, and.
Amendment.
All in favor of the amendment or any?
Aye.
Any opposed? Any abstentions? So the amendment passes. Next, I would like to, if there's no further discussion, to make a motion
To
for
approve it.
HH4 as amended.
I'll move it.
Second.
All in favor of HH4 as amended?
Aye.
Any opposed? Abstained? Carries. Thank you for noting that. Me. And HH5, authorizing the chair of the legislature and the commissioner of social services to enter into a contract with Cayuga Centers for the provision of 3 respite beds. motion to put this on the table.
Move it.
I'll second for discussion. When you look at this, it seems like their contract amount was much higher than you anticipated.
Yes. Yes.
So you had to take money from other accounts and put it into that account.
So this contract amount ended up coming in quite a bit over, almost $100,000 over.
Much more.
How much is it for? So this one is for three
How
hundred,
much more?
about
$100.
almost $100,000 over. We talked to Cayuga Centers. We weren't able to move them on the amount of the contract. We talked a lot about our utilization of the 3 beds, whether or not it made sense to drop down to 2 beds. They were fine with us dropping down to 2 beds. They didn't really need our business. They could pick up another county, grabbing the bed for the amount that they want to charge us. I think what's happened is the amount of our contract hadn't moved in quite some time, and the amount of money that they're having to pay staff and their own facility costs and whatnot has gone up tremendously, they've said. So they had to raise their cost.
You're still using this as like a reserved accommodation. When you need this bed, if it's not full, whatever time, for court intervention, for avoiding detention, all of that. This is.
Yep, so these are our 3 beds. So they're Cayuga County's 3 beds that we utilize for alternative detention for youth who need a place to stay, instead of going to an actual detention facility. We also use it for respite, because there might not always be youth that are in there as an alternative detention, but there's youth in the community that need a respite from, a family situation, or they're possibly on their way to going to detention. So we utilize it as an alternate to a higher level of care and a more costly level of care, actually. So when we take a look at how much this contract costs, I know it is a costly contract. The cost for a child to go to detention is much greater than this.
Is this one of the circumstances where you had said last month, next year, you may do some RFPing and or this is a sole provider?
I don't know. I'm not sure that we would find anybody to do this for us. That's, something that we can definitely consider and talk about. There isn't anyone else in the community right around here that does it. There's not even as many detention providers around the surrounding counties as there used to be. When we place a child in detention now, we're driving close to New York City and we're paying over $1,000 a day for a bed. It's very, very costly. So this is nice because it keeps the child in the community. If they're in respite, they're able to go to their home school for schooling during the day and go back to the respite house for the evening.
Are these individuals? Like, is this somebody's home or is it Cayuga Centers where?
It's a home. It looks like a house. It's a house. But it's a facility that's run by Cayuga Centers.
Okay, so
it's like a group
they
home
staff it. It's not like.
Oh, yeah. It's 24/7 staffed. It's run like a group
It's not
home.
like a person getting like a 1099. That's part of Hillside. These are staff employees.
Yep.
Okay.
Yeah, it's not a foster home or,
Okay,
it's-
that's what I was wondering.
nope, it's a group home model.
And these are for tougher children
Yep.
that had in their current environment in a home. Can't be in that home, they have to go to special treatment. Is that what this is?
Yep.
Where they're tougher to deal with possibly?
Yep, so some of them are facing juvenile delinquent charges through court. So they've gone before the judge because if they were of the, older age, they would be charged with a crime. And the judge feels that the child, that there's risk to the community for safety if they stay in their home with their parent. So he's decided that he needs to place them in a detention facility while he's working on whatever the disposition is of that matter. And then the other one is children that are sometimes those same type of youth that are really struggling with their behavior in school or at home. Sometimes there's physical aggression, mental health issues, and, having them have a break, having them be with professional staff while we connect them up to other services, connect the parents to other services, and give them like a little bit of a cooling down period can sort of stabilize the family with the hopes that this short-term intervention will be able to get them back home. And if it's not able to get them back home, then whatever our next step is as far as a decision that, the court's making, the parents making
Okay,
can take place.
thank you.
Christine, what is the you talked about juvenile justice and and that age group. What is the lowest age for respite care?
That can stay here in this. Um, I think that they can't be very young. So I don't know if the age is like 8 years old and up, but I'd have to get back to you. I can't remember. But I know like little young, very young children are not allowed to stay there. They're not,
But school age children,
well, I don't even think 5, 5, 6, 7, but I think it's like 8 and up.
8.
But if that's not right, I'll let you know. But it's older youth.
So the decrease in PINs at $67,000, how will that impact that program, that contracted program?
So what happened with these two lines of decrease? When we knew that we wanted to still enter into this contract for the $344,000, we knew we didn't have enough in the line that we had budgeted for the program and the approved 2025 budget. So we had to take a look at what we could do. We actually worked with Lynn. Lynn's on here. We had a meeting with Lynn. We talked about it. And what ended up happening, kind of get into the weeds here, but there was a contract that we had also with Cayuga Centers that ended up being budgeted for a year and a half's worth of funds for the diversion case management program. The contract that we had for 2024 was actually for a year and a half period of time instead of 12 months, just because I had brought that contract in a certain time in 2023 and contracted for a year and a half. When Lynn was helping us work on the budget, it got put in to that line for the added 67,000 that we didn't need. So we kind of found the $67,000 when we started looking over what we could do to try to, is there a way for us to come up with this money? Because the alternative was I was gonna have to come here and ask to do this contract and not have enough money in the budget and ask, for money to come.
Your fund balance or.
Yeah, so I knew that wasn't probably gonna be. Be a successful venture. So we worked with Lynn, we looked at it. So that was what the 67,000 was. The $31,000 was actually a decrease in the professional services line. And the reason we felt that we could do that was because we have a contract with Children's Home of Wyoming Conference that I've talked about here for 2 staff that help us with home finding and a staff that also helps us with foster care support. And they have had, there's been a time period where there has not been a staff in that position. So we know that we'll have some savings within that particular contract. So that's how we were able to kind of gather together that amount of money to increase this preventive services line.
Good work.
Does that make sense?
Yep, good work. Any other questions, discussion? Hearing none, all in favor? Aye. Any opposed? Abstained? HH 5. Report.
So I detailed some things in my report for you, including some of the information that I said I would give you about the rental supplement program, RSP program that I've talked about, and the SAFE program. And then I gave some information about the unhoused census and a little bit of information about different programs and services too, foster care, APS and CPS. So I thought that they would give you a little bit of information about numbers that we have and what we've been doing. If you have any questions, I'm happy to answer them.
The only question, quick, I had was the number of kids in foster care. Is that there's so many more kids coming in, or they're hard to get out of there, or a little of both?
Do you mean that number looks high?
Well,
Yeah,
down then it from what it was, or
we haven't really been under 100 kids in years. Yeah. It kind of ebbs and flows depending on, who's coming in and who's going out of foster care. But, we do have, we have 115 in foster care. The good thing is that we have many more youth that are actually placed in certified kinship foster homes than we have in years past. We've done a really nice job of
having conversations with relatives and kin of kids who are coming into foster care around the opportunity basically for the kin provider to be certified as a foster parent. The support that they get through the department, the financial subsidy that they get through the department can, sometimes help them to be able to provide for the child and just manage the stress and the different service needs that happen when you're taking a child in foster care into your home. So we've done a really good job with that. We have 14 youth that are placed in QRTPs, which is our residentials. So that's probably from what you remember, that's quite a bit lower. So 14 youth out of 115, about 10, a little more than 10%. That's not doing too bad. I mean, so we're trying really hard to keep the youth out of a QRTP level setting, but we do have some tough youth that really need to be served at that higher level of care.
Thank you, that's.
Okay.
Yeah, thank you for these very detailed statistics.
What is this?
And the January 31st census on homeless pretty much found what your numbers have been.
Yeah, pretty steady, running steady for the last few months. And our placements are, consistent with what they have been as far as, where we have them.
Sorry. Apologize. I'm trying to understand. Can't turn off the case. I apologize. But
That's it.
Thank you.
Okay, thank you.
Lauren Walsh. There, here. Mental health, start with your resolutions, HH6, authorizing the chair of the legislature to sign an agreement. The New York State Office of Mental Health funding for court-based mental health navigators. May I have a motion, something?
What?
You.
second,
So this is new state aid funding that's earmarked for court-based mental health navigators. So this is a new initiative by OMH, and it's really about working with the court systems. So anybody that's criminally, in the criminal justice system that has a mental health disorder will be linked to these navigators who are supposed to be doing initial screenings, referrals, really working with them to make sure they're connected to the appropriate services and understand all the resources in the community. They'll be working along with the courts as well as any peers that are also involved in the court system as a way to connect people to services, including substance use services as well.
And the navigators do not have to be licensed social workers.
Correct. So it's more of like a case management position. We worked with Amanda in purchasing as well. So we're going to be, we created an RFP. We're going to go out to bid for this service. We're going to contract it out. So it's not going to be a county position. So this resolution allows us to do that as well.
Yeah. You see that's mentioned here clearly.
Yes.
It's a well-written, thorough resolution. Thank you.
We required, or it's just something that.
We were, not every county received the money, but we were one of the counties that were identified as a need. So I don't know how they assessed that, but we were.
They approached you to say, take this money and.
It actually,
Service.
yeah, kind of showed up in our state aid letter first and then got more information around it afterwards because it was new money that kind of showed up for us.
You did get a nice shout out from Sheriff Skank
Yeah.
last night at the JPS committee about, he was aware this resolution was coming up and was excited about these additional services. Any other questions, discussion? Hearing none, all in favor?
Aye.
Any opposed? Abstained? HX6 carries. Page 8.7, authorizing the chair of Cayuga County Legislature and the Director of Community Services to create and fill one full-time coordinator of substance use initiatives. Motion to put this on the table.
I'll move it.
Second.
So this is a position that was formerly under the project manager title, which originated from the Healing Community Study. If everybody remembers the work done around substance use, especially the opioid use disorder. This position has since evolved since then. I think it's really has way more responsibilities and tasks. So I met with Personnel Committee as well as HR. We redeveloped the job description to make it better fit. There's a lot more responsibilities as far as it's not just one project, it's about 4 different projects or funding sources as well that this position has managed. It's 100% grant funded. So through opioid settlement funds and grant funds, we will fund this position in our department. It really is essential, I think, not only for the mental health center itself, but also the community. We worked on a lot of grants that not necessarily don't benefit us all the time with funds for us, but we're also working together as a countywide approach on substance use. So we have a lot of partners that these grant funds have assisted, and there's a lot of great work being done through those. So I think it is essential for this position to be filled. So it's kind
And
of,
the create came in response to a resignation, I understand.
yes, unfortunately.
And, that is often the time when department heads take the opportunity to take a look at the current job description and job and take it to HR and take it to personnel. You followed that pathway. Also, have in your resolution indicated that this is 100% grant funded. The position will be eliminated when the grants expire.
Correct.
Second, first and a second? We already did? All right.
We have that.
Okay.
Can I ask, what is the range, the
Yes.
salary range for this? I'm just curious.
I have it right here.
Is
I have it right here. 67 to
Oh, I didn't see
start,
that. Yeah, I had it attached. I'm sorry.
or 64,
Gotcha.
872
To 74. Okay,
to 74.
perfect. Thanks. Just curious.
Yeah, I think that's another reason we took a look at the position too, because as far as like recruiting, actually hiring someone for the position, we needed to look at all aspects of it.
There are contract people that are being supervised by this grant coordinator or by this
Yes.
substance use
There's
initiative.
actually four staff members now as well. So in addition to the work that was being done, there's also 4 employees that are doing work that this position will
They're
supervise.
Contractors.
Correct.
Rather than employees.
Correct. Yep.
Yeah, so again, made good sense to help the county with, all of those costs that come with bringing someone on to payroll.
Yep. Yep.
Which I appreciate in terms of budgeting and, forward thinking. Any other discussion, questions? Okay, all in favor?
Aye.
Aye. Any opposed? Abstained? 7, passes. Carried.
So for my report, I'm also doing my quarterly compliance report like Kathleen did. Just a couple notes. This is for the last quarter of last year. So really it's through October through December. We will be presenting quarterly moving forward. So this is just, it outlines what we do internally to perform audits so that we catch things before they go out for billing if things aren't correct. And the number one thing that we focus on is our documentation. So a treatment plan needs to be signed and active before, if any billing goes out without that, then that results in some retractions sometimes. Just for the last quarter, just to put it in perspective, we did have to do 2 separate retractions. It was no more than about $1,000. And just to put it in perspective, in 3 months, our revenue is, almost $280,000. So to put that kind of in perspective.
This is your Medicaid claims that are
Yes.
subject to this compliance review.
Correct. And we put in place some, one corrective action plan with a therapist during this period of time, just to make sure that we're on top of their paperwork. And we do this, we have, our utilization review, we have, a lot of checks and balances internally. I will say part of my report too is our, new EMR this should not happen at all anymore. We're really manually checking right now. There's nothing in our current EMR that sort of like checks things and doesn't allow things to go out for billing if the necessary treatment plan is not there. That will not happen at all with our new EMR because the billing just won't go out. So I think that is a positive change. And, I think I put in my report too, that the go live date, we're looking at May 5th.
And that's much earlier than we thought.
Yeah, I mean, I think there's a lot of kinks and it makes me a little nervous. They're still building everything out. So the good thing is we have say in all of that. It's just, that's our go live date as of now. I'll keep everyone posted if the date does change. But it's really exciting. I think it's going to make things a lot easier for everybody. Like there's so many manual things happening right now that take a lot of time. So we'll be looking at that as we move forward with the new EMR. But yeah, it's a big undertaking though, for sure.
Challenges.
Yeah, it's bad. It's pretty bad. Just this week alone, I think as far as what got in my radar, there was 8 people that couldn't make it to their mental health appointment, based on just parking alone. I mean, from the nursing home to the hospital, I mean, you're talking like blocks away, even if you wanted to park on the street. It's just really congested up in that area. So I just want to keep that on everyone's radar. I know there was obviously talk previously about doing some work to our parking lot to make some additional spaces. And I don't know what's happening at the hospital, but I heard the one parking lot next to ours might be going away. They might be building something there. I don't know. I'm not sure. So it's a big problem across the few blocks around us. So I just want to keep that on.
Point, there was talk about the pergola coming down.
Yeah, we're supposed to remove the pergola and
We talked
extend
Yep.
the parking lot to create, I think it would be like over 10 more spaces, which would help. But I just wanted to kind of bring that up.
I don't even remember how much that was
Something.
slated to cost.
Talk to Public Works and Tony about.
Can't remember either. to be honest with you. It was a while ago.
City and codes.
Oh, city code.
City and code.
Oh, yeah, there was a
Oh, that's
code
what stopped
enforcement
it.
needed to, yeah.
Okay.
Just want to keep it on your radar though. I just feel bad, especially for our clients, if they're missing their mental health appointment because there's no parking.
More importantly, the discouragement.
Right.
They already, they gotta go and come back the next week and maybe there's not a parking spot then.
Come back.
Right. Or I know some of them have reported like driving around for a while looking for a spot and then calling and saying, I can't find one. Like it's been, 10 minutes into my appointment now and I still can't find one. So I'm going to reschedule my appointment. But right, then you don't know, like, is that time the most convenient for them? And then they schedule at a different time that's not, so I just want to keep that on everyone's radar. And then my last thing is, I did put some things in here around the work that we're doing at the jail. I think, in 2023, we really changed everything about what we were doing there as far as mental health. There was a lot of grievances from incarcerated individuals. So we took a really hard look at this and we really changed everything from the personnel that was there to how we're working the whole mental health system in the jail itself. So I put some notes just in general. We added a part-time position, social worker to the jail. We identified 3 new nurse practitioners that are on a rotating schedule. They're on call for 1 week at a time and then rotate. And they also go out for a 3-hour block where they see people that are referred to them. They're seeing everybody that's referred to them. That wasn't happening previously. There wasn't enough capacity for that. Our social workers have regular supervision with a supervisor from our clinic. And supervisor from our clinic, as well as a supervising nurse practitioner, attends weekly meetings at the jail where they prioritize people based on their mental health needs and what's going on with them. I would say, I don't think the jail staff and our staff have worked any better together than they are right now. We really have a good team of people there, and their medical staff also working with our staff is going really, really well. There was a time that there was stacks of grievances from mental health at the jail, probably at the beginning of when I came into this position. One of the jail staff recently looked back and they only went back so far as September. They didn't go back any further, so, but there hasn't been one since before then.
Congratulations.
So I think it's just important to note like what great work. And there's a lot of higher acuity of people that are in the jails now with mental health concerns. We, like you guys have seen with the 730s, a lot more people are going to psychiatric hospitals because of the state that they're in when they get to jail. And on that same note, there is a big push from the Conference of Mental Hygiene Directors of the state. So all the DCSs in the state are working with OMH to make changes to the 730 legislation. It doesn't work very well. People aren't getting the treatment that it's not really treatment, it's restoration. So there's really taking a hard look at that. We actually have a meeting at the end of the month where all the DCSs are meeting with OMH to talk further about just the inequity that there is there. So I just wanted to say that there'll be more updates as things come out of that.
You would say right now there's only one?
Yeah, I'm gonna,
Oh, knock on wood, because, yeah,
last year was,
a record.
it was a record. There, we haven't seen that. And and those people I can say needed to go
Mhm.
for sure. So,
Thank you.
any questions on any of that?
Thank you.
All right, thank you.
Thank you. Okay, at this time, I will entertain a motion to adjourn.
Second?
Favor?
Aye.
Thank you, everybody.